Good morning, Dr. Richard Buckley, Milford MD, live at you from Pennsylvania, Pocono Mountains, good US of A. Our patient this morning wants to have bigger breasts, so we're going to do breast augmentation. Are you awake?
Yes.
Yeah. And how are you feeling?
Amazing.
Oh, amazing. And you're pretty excited,
Very.
right? And we're going to do all of this with our lovely patient, wide awake this morning. I've numbed this little area right here. I'll make a little incision there in a minute, make a little pocket under these areas that I've marked, after which we will put some implants in there. So you can see how she looks now. A little later on today, I will bring you back and I will show you the implants going in. We have arguments here sometimes about how long it takes to put the implant in. Staff once said it took 5 seconds. It doesn't. It takes maybe a second and a half. Sort of like plop, plop, right? And so that will be breast augmentation, while awake, local regional 2-method anesthesia only. And we're going to get back to work here. Don't need to show you any of the details. I think it's probably not very interesting. But we will bring you back a little later and show you the implants going in. That's pretty exciting. Stay tuned. Richard Buckley, Milford MD. Richard Buckley, Milford MD, promised you seeing some silicone implants going in. We've made some little incisions at the bottom of the breast. We made some pockets. And this is an implant in what's called a Keller funnel. And I can take that, put that there, and do that. And now you can see this breast is augmented as compared with its neighbor. I'm going to put an implant on the other side here momentarily. It's very much like a pastry funnel. That's probably what it is, pastry funnel. Okay? So how was that?
Good.
Good?
Amazing.
All right, amazing. Okay, and here we go. How long does it take to put in an implant? Let's see. Ready, set, go. 1, 2. Okay, let's say it takes 2 seconds. So now we have 2 implants in. All I have to do is sew up that bottom little incision and we're all good. They sit very nicely in their new home and they feel natural. I'll put some stitches in the little fold down here at 3 different levels, a deep one in the dermis, and then one just intracuticularly, slightly under the skin. And there won't be any stitches on the outside when I'm done here in just a few minutes. Richard Buckley and team at Milford MD. We are done with our breast augmentation for today. And our patient's been awake the whole time. And since we're done working now, I can have her tell you what she was thinking that led her to wanting the implants and how long she's been waiting for the implants and yeah, how the procedure was.
So I'm sitting here post-operation with Dr. Buckley, whom did a phenomenal job with his team. I've wanted implants for a couple of years now, and I've gone to a few other surgeons, and they felt like home here. So I had a great experience. Definitely.
Our patient's smiling ear to ear. We're not going to show you her face.
It was definitely an insecurity that I wanted to fix, and now it's fixed.
Yeah, did you have a chance to peek?
I have not.
You can lift your head up. Oh my gosh, right?
Oh wow.
Oh wow. You want to say that again?
Oh wow.
New toys, yeah. And so what's that going to mean for you?
Definitely a confidence boost. I love that.
Yeah, it's all about confidence. And it's not about being huge. It's about just, the right size that you feel happy with.
Yeah.
And
Proportions.
Can you imagine in bathing suits and stuff now?
Yeah.
Ooh, yeah. So, our patient in a minute is going to be able to just, jump up, put a little bra on for her, and she can have some juice and a sandwich or something. What'd you bring to eat? Something
peanut butter and jelly.
Peanut butter and jelly. PB&J sandwich. Good. Did you have breakfast actually? I mean,
I did.
Yeah, we do ask our patients to have breakfast. So it's not one of those things where you come here without eating. Since midnight. We don't do that. I want everybody to have a nice breakfast, and I want everybody to eat and drink some non-alcoholic beverage. When the procedure is done. But our patient's going to be good to go. Are you comfortable at all now?
Comfortable.
You don't have any pain?
No pain.
You just feel somehow tight.
Yeah.
Probably. Yeah, it should be. Because it's tighter there. Yeah. Historically, after 6 months, people totally even forget that they've had any implants. So they're used. Right?
Yeah.
Yeah. Sometimes people ask about flipping them out maybe every 10 years. I think, with the modern implants, which are not gooey on the inside, so even if you cut them into multiple pieces, they don't drip. I think you can leave them there a very long time. Yeah. So if they're not bothering you, you don't need to bother them. Statistically, they're considered devices, and there's probably about a 14% statistically incidence of people changing things per year. They maybe want to get bigger, they want to get smaller, they're in some position that needs to be fixed or something like that. But that's not actually been our experience. In general, I think if you try on the implants on the front end, which we did, we spent a little time figuring out what size you liked and we agreed, then I think that helps you to be happier and satisfied with them after the fact. Some people don't do that. I think they leave it to the doctor to pick out some size. I don't like that. I think you should pick it out with our guidance, and then we don't disagree with you, and then everything is good. So guys, thank you for watching another episode of Milford MD, and thank you, patient, for contributing.
Thank you.